You're welcome back to Sunday Breakfast on ChannelOne TV. It's still Breast Cancer Awareness Month, and today we'll be discussing breast cancer part 2 with our very own Dr. Oum-Kalsoum Adams. But before then, if you have any messages, do send them across all our social media platforms with the hashtag Sunday Breakfast, or send them to our WhatsApp number 0204 447 033 0204 447 033. Also remember that alternatively you can send them to my ex handle ino_s or Jude's handle at Mensa Duncan, and we will definitely ask Doc for you. Doc, you're welcome.
Thank you.
How are you doing?
I'm well.
How's your week?
Up and down, but hey, we are living.
We certainly are. So let's recap, because I don't want us to, do the formalities too much, but then when the show is ending, when your segment is ending, then the questions are coming in. Yeah. So let's just briefly recap what we did last week so that we can delve into today's questions.
Okay. All right. So as we all know, we're in October, and October is Breast Cancer Awareness Month. So it's a month that is set aside by WHO to raise awareness and then educate the public and equip us with some information to help us know our breasts and then our breast health as well. And last week we spoke at length about what breast cancer is, which we said that breast cancer is basically when you have cells within the breast becoming or dividing uncontrollably to become cancerous. And we went on to talk about some of the signs and symptoms and then the risk factors associated with breast cancer. So we mentioned that some of the risk factors associated with developing breast cancer basically, the major ones are being female, that's your sex, being female, and then also your age, that's once you're aging. And we mentioned the fact that being old, yes, it's a major risk factor, but then certain studies that have even been done locally here in Ghana show that approximately about 30% of all breast cancers actually happen in women who are 35 years and below. Yes, so it's emphasizing the fact that some of these trends that we know are changing, are not cast in stone, that yes, once you're aging, you have a higher risk of developing breast cancer, but almost everybody has the risk of developing breast cancer. And then the fact that you being female, yes, gives you puts you at risk of developing cancer, as opposed to men. Even though we have certain men, a small percentage of men also developing breast cancer. So we have about 0.5 to 1% of some men as well developing breast cancer. Then we went on to talk about the risk factors, and we went on to talk about certain signs and symptoms that you should look out for. That if you have a lump, which is hard, you have some changes within the breast itself, maybe the shape of the breast, the nipple, the direction of the nipple, and then you having certain associated discharges, so bloody discharge and all of that. So we spoke about all of these as at last week, and then I think we delved into certain facts and then some myths associated with breast cancers.
There are a lot more of them, right? The misconceptions. Maybe we'll also find some time to talk about the stereotypes and the stigma and how not to be a part of that. But still on the myths and misconceptions, so I want to mention it, then you tell me whether or not it is and why it's not. So for example, they say when you have big breasts, you are more predisposed to breast cancer.
So I would say that you having a good volume of breasts, yes, that means that you have more breast tissue. So it can't put you...
So it's not a myth.
It's not a myth, yes. But once you have... The good thing about having good volume is that even if you do develop breast cancer, it means that if it's diagnosed early, you may benefit from certain treatments as opposed to somebody who has very small breasts. So if, let's say, you want to just take out the lump, okay, as opposed to taking out the whole breast tissue. So imagine you have a small breast and then you have a large breast, and then all of you have developed maybe about a 2 centimeter lump in there. Okay, the person who has a larger breast would mean that even if you go in and just take out just the lump, there will still be some breast tissue there.
Okay.
And that's more cosmetic compared to somebody who has a very small breast. If I take out just that lump and then some good tissue around it, it means that it's amounts to nothing.
Yeah.
So you'd rather benefit more of doing the whole mastectomy for somebody who has smaller breasts compared to somebody who has
How
larger
about
breasts.
somebody who's had...
So that is where the dynamics are.
Interesting. How about somebody who's had an injury to the breast from whatever cause or source?
So injuries can give you something we call mastalgia. So mastalgia is pain associated with the breast, yes. And then there are times that you can end up even bleeding into the breast tissue and all of that. But those are minor stuff. So not necessarily predisposing you to getting breast cancer, but you can end up having certain signs and symptoms, yes, that you may. But definitely, once it's inflammation, with time it passes and you're fine.
I was watching a video where the lady had announced that she was cancer-free, and she said she did her mammogram checks consistently, but they didn't find it.
Anything.
They found a lump in her armpit after someone suggested that they should check that area as well.
Yeah.
Does that happen a lot?
Yes. So as I mentioned, I think last week we mentioned that the breast tissue, especially when you divide the breast into quadrants, let's say you just draw a cross across the breast through the nipple, okay, both horizontally and then vertically. You notice that you have an upper outer quadrant and then a lower outer quadrant and then the inner quadrants, both upper and lower. The upper outer quadrants, most of the breast tissue is actually within the armpit. We call it the axilla. Yes, so sometimes, or in fact, almost all the time, in your breast examination, you are supposed to examine the armpits. It is a must because most of the breast tissue in the upper outer quadrants is found within the armpits. And if you do miss that, it means that you may have missed a substantial amount of breast tissue that you haven't examined in your regular examinations, your monthly examinations. So it's very important that if you are doing your self-breast examination or even if you are undergoing a clinical breast examination, yes, the axilla needs to be examined. Very, very important. There are times that you may not even have an overt lump or, yes, a lump within the breast, but you may end up having something scanty or something little within the armpits. It may have started from that area. So it's important, and people need to know that, yes, the armpit is part of the breast, and you need to examine it.
I think you should teach us the examination again. How do we go about it?
Yes, I will go through
like the self-examination.
Exactly. So I would go through it today. So maybe, so when you are undergoing a self-breast examination, the first thing you do is that you have to look. So you can either do it comfortably seated or lying down, or sometimes people prefer to, so either you sit or you lie down. I think that those are the two positions that you can comfortably do them. And then you look, so you expose your chest up to your waist level, and then you look. So you're going to first of all look at the skin. You're going to look at the area around the breast, the two breasts. So do I have any shape changes? Does one look bigger than the other? Does one look a little funnier than the other? Is there any discrepancy in the sizes? So you look at all of these. Are there any skin differences? Do I feel like there's a lump somewhere that is holding onto the skin such that it's given this puckering or tethering appearance of the skin? Okay, and then for those who have much larger breasts, and then they have some skin beneath, such that you need to lift the breast. So you need to lift the breast as well, and then look. And then the next thing that you do is that you need to lift your hands or your arms, your upper arms, all the way to the level of your head. Okay, so once you do that, it only helps to accentuate anything that you are not seeing without contraction of any of the muscles within that are holding onto the breast. So sometimes when you do that, it helps you see that maybe there's something here that I'm missing. Okay, and then the next thing you do is that you are going to hold onto put both hands around your waist, and then you press inwards. That also helps you to accentuate if there's anything. And since you are going to do the self-breast examination, you are the one going to examine your breast. So your right hand examines the left breast, and then your left hand examines the right breast. So right after that, once you have looked and you think that you've looked enough and you can't see any skin changes, you can't see any lump, and then the nipples are also facing where they should be facing, is not inverted, or one is not moving inwards as opposed to the other moving the other way. And then you also check, is there any free-flowing discharge from the nipple as well? And then are there any ulcers? Once you have checked all of these, then now you can move on to touch. So you are going to touch with your 3 middle fingers, okay, the parts of your 3 middle fingers. And what you do is that you can lie down. So you lie down, and then your arm, if you are using the left hand, it means that you are examining the right breast. So your right arm will then have to go behind you, and then you lie down. Sometimes you can use a pillow to support your back. Okay, and then now you use the 3 parts of your fingers, your middle fingers. Then you move on to do something we call palpation. So palpation is you're just massaging or you're touching the breast, and you don't touch the breast this way. Rather, you touch the breast against a hard surface, which is your chest wall. Okay, so you are going to go like that, and then you press on, but do it in an organized fashion. So you have divided it imaginarily into 4 quadrants. So you start that way. So if you are starting from the outer quadrants, then you start from the outer quadrants, you go gradually, and then you check. You are feeling for any lumps. Are there any lumps in there? And then you are feeling for any abnormalities within the, within the breast itself. So you do all of that till you cover all the 4 quadrants. After covering all the 4 quadrants, then the next thing you would want to do is that you go straight to the axilla or the armpits as well. So for the armpits, you also check in all areas. So there are 4 areas that you check. Very close to the chest wall, away close to the arm. Then you also check around the medial aspect, and then the outer aspect as well, and then the apex itself. So you check, you're just palpating, you're just touching to see if there are any small lumps that you may feel. Then you move on to your nipple areolar complex. So your nipple areolar complex, you're going to try and squeeze it. Okay, so you squeeze it to check in 2 directions, both horizontally and vertically. You squeeze it to check if there's any discharge, bloody stained discharge coming out from the breast as well. So once you do that, you'd have completed 1 breast examination, and then you move on to the other one. So you flip your hands, and then you move on to the next breast, and then you examine that thoroughly. In case you find any of the things that we are mentioning, that is, you feel that the skin looks like onion peel, you feel that there's a lump that is hard in nature, or you find any nipple discharge, or sometimes there's even an overt ulcer or a sore on the breast. As soon as you find any of these, please quickly rush to the hospital and get it checked as soon as possible, because it may be breast cancer that we are dealing with. Wow. So at least once you turn 20, it's important that this self-breast examination becomes, you learn it, okay, and it becomes part of you. So anytime within the month after your menses, 7 days after your menses, then you can go on and have this self-breast examinations. So at least 12 times in a year is not too much to ask of for your
Definitely not, for your own safety.
Exactly, for your own safety is not too much to ask of.
Wow.
So once you do that, and then if you are above or you're 40 years and above, 40 years and above, aside doing the self-breast examination monthly, it's also expected that you have a clinical breast examination done by a professional at least once a year. And then you can corroborate that too with your annual mammograms that you do. So that you, I mean, you catch whatever that it is at a very early stage, because we always say that early detection really does save lives.
Wow, that's a whole lecture on its own, taking us through the process and all.
Yeah,
but maybe I wish you could just do like a yes or no on some of these myths, then we move on.
Okay.
So I also hear people say that the part of the populace that sort of use second-hand underclothing, like bras and other stuff, are also predisposed to breast cancer.
I would say no.
Pardon?
I would say no to that.
It's a no.
Yeah, it's
wow.
a no.
Interesting. No, because
breast
you know,
cancer has nothing to do with what you wear.
What you wear.
Yes, it's more of, as we said, some lifestyle choices affect you, like alcohol. And I'm sure now you know, because I've been on this show and we've spoken about alcohol a number of times. Alcohol consumption.
Let's not go down that lane.
And then smoking, you know. So those are some of the modifiable factors that you can look at. But the rest, as I said, about 75% now of breast cancer is sporadic. It just happens without you really having to put something to it that, okay, this is really what caused it. Yes.
But are all breast cancers the same?
No, they are not. They are not in the sense that they are different histologic subtypes. Yes, and some of them have some receptors, hormone receptor positives, and then those who do not have the hormone receptor positivity. So there are variations when it comes histologically, and then even genetic-wise. There are some that have the genetic predispositions as opposed to others that do not have the genetic predispositions. And then, even after that, when you are diagnosed, it has to be staged appropriately. And even the staging puts people apart. Somebody may be early disease, others may be late disease, depending on the stage and then the extent of spread, either locally or distant metastasis. So it all depends on, and it's not one size fits all. It's actually individualized. You need, once you're diagnosed, it has to be individual, and the therapy has to be individualized for
so it's wrong to say all cancers are the same. The treatments differ.
Yes.
There are some questions here for you. A lot, actually.
Okay.
Good morning. My name is Kingsley, and my wife is a survivor. I want to know if there's a tendency of cancer cells to grow again. Good morning. I'm watching from Spintex. Kindly ask the doctor some exercises one can do to minimize getting breast cancer. And I was about to ask this question anyway. It says, hello, kindly ask doctor the idea behind no bra day. Is it that wearing the bra increases one's chances of getting breast cancer? Because today is no bra day.
You spoke about it briefly last week.
No bra day.
Yes.
Okay, yeah, I think I spoke about it briefly last week. I spoke about the fact that, yes, there's no documented literature that if you do not wear a bra, it reduces your risk of developing breast cancer.
So it's just an awareness.
So it's just an awareness thing, yes, that people are just trying to. It's their way of also raising awareness about breast cancer and then breast health and how we should take care of our breast and all of that. And then I think there was another question about the fact that one was a survivor.
Yes, his wife is a survivor, and he's asking if there's a tendency for cancer cells to grow again.
Yes. So once you're a survivor, I do not know the details of the histology of the cancer and all of that. But once you've had it before, and what was the treatment that was given? Was it a mastectomy? Was it a chemo? Was it whichever treatment modality? But once there's some breast tissue there, I remember last week I mentioned that Another risk factor is that maybe somebody may have had breast cancer and then a mastectomy was done or surgery was done to take out the whole breast away. But then the presence of the breast tissue in the other breast also puts the person at risk of developing another breast cancer. Yes. So once it depends, I can't give a straight answer to it. I would need to know a little more about this particular patient. But all I can say is that if a mastectomy was done and she's breast cancer free, but she has the other breast there, and depending on the histology of the cancer that was taken away, once she has the other breast there, predisposes her to getting, it's a risk factor, it's an increased risk factor of her developing another cancer in that breast.
This one's asking about exercises one can do to prevent it.
So there isn't any specific exercise, but as I say, exercise is always good. So you can do all the exercises, if it's from cardio to all the exercises that you know, but there isn't any specific exercise to help you prevent developing breast cancer.
There's another one. Hi,
but
good morning.
Is good.
My name is Kweku. Is it true that sucking on a woman's breast helps prevent breast cancer?
No. So
did you
the
ask
last
this question
time,
why are you watching my face?
Yeah,
Why are you watching my face?
I'm just saying that did you ask this question last week?
I don't remember.
Okay.
I don't remember.
he did.
He did, huh? Yeah. I recall you asked it.
So sucking on a lady's breast, no. If it's an adult, no. It doesn't have any increased risk or reduced risk of you developing breast cancer. The only thing that I mentioned last week was the fact that if there's a lactating mother, yes, and then she's lactating and the baby is sucking, yes, it helps you, it reduces your risk of developing any cancer at that stage. But aside that, normal adults sucking on breast, no, it has nothing. There's no documentation like that.
Wow.
Yeah, so we mentioned that last week.
Interesting. Maybe you can just do a little more of the myth busting for us, right?
Okay.
So people don't walk around with some really unhealthy ideas about what we are saying. I remember last week.
Some people even say that, oh no, I don't have any family history of breast
so
cancer.
I'm safe.
So I'm safe.
No,
it's not for me.
no,
I don't want to
no.
even hear about it and all of that. But that's not true. That's a very big or a false information that they carry in their heads, because as we said, most of them are now sporadic and you can't really tell exactly what is the association for them developing the cancers. Yes, and it's sad. So it's a matter that we all need to know about. We all need to be interested. If you're a man, as we said, about 0.5 to 1% of men also end up developing breast cancer. So you need to listen as we are talking. If you have switched on your television, you should watch. Yes, and then you can educate yourself. You can also educate your mothers. You can educate your sisters. You can educate your daughters and everybody else, so that we all know about breast cancer and we all help in the fight. Because actually this year's theme is no one should fight breast cancer alone. So we are all in this together.
Yes. Very apt.
Yes. So we
There's
are all
a question
in this
here.
together.
Good morning. I have a sister who has one of the breasts bigger than the other. And when I advised her to do a checkup, she said it is due to breastfeeding her baby with one breast mostly.
Okay. Wow.
Yeah, so she needs to get it checked. Everybody doesn't exactly have the same size of breast, let's say left and right. There's usually a little discrepancy, but very small and not noticeable. But once it is noticeable, then she needs to have it checked. And hopefully, if there isn't any lump in there or there isn't anything growing to cause that discrepancy in the sizes, then we are safe. But once there is something in there, then we need to check it out. So I would advise that she goes to the hospital and have it checked.
There's another one. Kindly ask the doctor how one can mentally deal with the news of having breast cancer, especially with all the stigma attached.
Yeah. This has actually touched my heart, because it's the reality. It is the reality. because a lot of people cannot deal with that diagnosis. Having to think about the fact that, yes, I have been diagnosed of one cancer and no other place but my breast. And then the other thing is that with the thought of, for them to even have it in, accept it, before they are even open to the treatment options available, the thought of you losing one breast, the thought of you having to undergo chemotherapy, which comes with its own side effects, which come with its own discomforts and all of that. Yes, it's a really difficult thing. But one way that at least most facilities that I've seen help manage this psychologically is the fact that now we have, so treating breast cancer is a multidisciplinary approach where you have professionals like psychologists who are trained to be able to help you get used to the news. That's one. And then also to help you throughout the journey. Once they provide psychological therapy to you, once the diagnosis has been made. And then the good news is that there are a lot of survivors as well. And these survivors actually have groups. And these groups would help you, encourage you.
One another.
You know, sometimes when a doctor is seated and then telling you that, oh, this and this and this, and I'm sure that the whatever that goes through the patient's head will be like, you don't know.
Yeah, you're the one whose breast is being cut.
You know, that kind of thing, because they feel that you are not going through the same thing.
Yeah.
You can't empathize with them. You can't be in their shoes.
Yeah.
So sometimes it's good that we have these NGOs where you have a lot of survivors who have come on board. And then what they are doing is that they are helping others feel comfortable. They're helping others see the light, the fact that, oh yes, I was also diagnosed with breast cancer, but I have gone through A, B, C, D, now I am disease-free. Yes, we can hold your hand. Yes, it is doable. Yes, some people have actually been lost through the whole journey. But yes, there are a lot more success stories, and we are there to help you. So all of these, there are times that when you diagnose people, they don't want to accept it. But once you bring in a survivor, and then the survivor talks to them.
So like that whole support system.
Exactly.
So reason why it makes
support system is very important.
Wow.
Very,
you know, it makes
important.
the theme for this year even much more relevant, right? In that you are not alone, right, in the fight against it. And I mean, you want to urge, you know,
alone.
So for example, somebody sent a message and was asking if it's contagious. Of course it's not, right?
It's
You
not.
can't listen to doctor for 2 weeks and still have such a view. So we need to do better as a society, right?
Yeah.
And when I say society, from policy makers, policy implementers, even legislator, right? Because what care are we giving to people who've been diagnosed and for some reason can't afford the health care or going through the whole process? So we need to do better as a society, right? The media, I think we are doing our work in trying to put out a public education out there, right? But it goes beyond the media, and I'm so grateful that you've dedicated your time really to do this education for us. Personally, I've learned so much, right? A lot of the time you're talking, I'm just quiet because it's it's such a new thing for me, right? I know we've had October month, Pink month, but I didn't really pay attention to the severity of it. And when people come out with their stories, yesterday on the show, we had a spread in the Mirror newspaper where a survivor was sharing a story. So,
and I like it when survivors come out and talk about it because others now see themselves in those survivors, and then they are more receptive to the treatments. Yes, so it's very, very important. And at least I know in Kolebu, every Tuesday there's a group like that who meet.
In October, or it's
no, I mean throughout the year. So it's a survivors group. They come together, they meet, they are able to also help new people who have been newly diagnosed to accept their diagnosis and go through. They help them go through the whole treatment that needs to be done. And I think it has helped tremendously.
Wow.
it has helped tremendously. And then it's sad that we still have people stigmatizing. As we mentioned last week, yes, it's still happening, even though every October we set it aside and then we come out here, we talk about it, hoping that people get to be educated about breast cancer and all of that. But it will surprise you to know that people are still stigmatizing.
Sometimes it will shock you that even those who should know better,
yes,
who find themselves doing that.
stigmatizing people about breast cancer. People do not want to share plates with people who have breast cancers. People do not want their children to associate with somebody who has been diagnosed with breast cancer. How do you expect this person to be mentally even ready to undergo his or her treatment? No. So I always say that it's not about the education. It's about what the education is doing to our practices. How is it influencing my effect, or how I relate with somebody else? So it doesn't end at education. No, it's actually starts from there, where the education that I am receiving, how is it influencing my practices?
Wow.
It's important.
It's very, very important.
Yes.
So if you are doing that, please stop. You've managed to take Doc from her medical professional space to give a really emotional appeal, right? So please, like, we should do better, right? Like I was saying, as a society, we should look out for each other more. We should be each other's keeper. Let's try and build a healthy support system.
Very important.
Wow.
Very
I like the way you give that emotive appeal. It's very important.
Very important. Wow. And it's important that at least we appreciate all the survivors who come together and form these support groups to help others who are starting the journey. And I'm very grateful for these groups. And yes, as we have rightly said, yes, no one should fight breast cancer alone. And we are all in this together, and we would fight it.
Like
one
that
day.
famous maxim, we rise by lifting others up, right? So,
exactly.
Wow. Doc, thank you so much for the enlightenment, really, and the insights into this conversation.